Hi everyone, welcome to our Social Innovation in-House Mid-Year Training Workshop 2024. I am delighted to see so many of you joining us for our second session. So before we dive into today's presentation, let me explain how to use the translation feature to ensure everyone can follow along comfortably. First, find the caption icon at the bottom of your Zoom screen and open the translation function. And for my speaking language, choose English. And for my caption language, click on the icon and select your preferred language from the list. And next, I'd like to remind each of you of a few housekeeping rules to ensure a smooth and productive session. So please keep your microphones muted unless you are called upon to speak. And then if you have any questions, just feel free to type them directly into the chat box and our team will respond. And also, please use identifiable names for yourself and avoid generic names like iPhone 123. And also, please ensure you have a good internet connection, and you can also view the archived version later. All of our PowerPoint slides and videos will be archived on our website within the next 24 hours. And you can visit our official website for access, and Zixuan will share the link of our official website in the chat box. And last, if you have any questions, feel free to email me at any time. So now it's my great pleasure to introduce our distinguished presenters for today's session. We have Mr. Godfrey, who is a tutor and a clinical nurse at BSM Mooney University, and Ms. Bertha, who is a CHI fellow from our CHI Malawi Hub. And finally, we have Dr. Uma, an assistant professor at Wake Forest University School of Medicine. So today, they will give you a session entitled Social Innovation in Health, Introduction to Social Innovation Theory and the KAP-B Framework. And to help you define social innovation in health and also explain some key theories and introduce the KAP-B framework for addressing social issues. So without further ado, let's get started. And please join me in welcoming our Mr. Godfrey, Ms. Bertha, and Dr. Uchuma. So it's over to you.
Well, thank you, Yusha, for the wonderful introduction and trying to help us set the stage here. I'm going to go ahead and share our slides. Do you all see our slides okay?
Yes.
Awesome. Okay, so we're going to get started here. Like it's mentioned, my name is Uchoma, and we also have a member of our team. Godfrey, would you like to introduce yourself a little bit before we go ahead?
Yes, please. My name is Godfrey Michael. I'm one of the members in the team, and it's a pleasure having all of you attend this session. Thank you.
Lovely. Thanks, Godfrey. And the other member of our team, Betha, is unavoidably absent, but she sends her regrets. And this was really a team's effort, so all three of us put it together. So I hope that you enjoy it, and we are open to feedback, and hopefully you can get something out of this. Well, so to begin, as Yusha introduced, our presentation is focused on introducing social innovation theories and as well as the KAP-B framework. And the hope is that at the end of this session, we have a sense of like how social innovation and health is defined. And I think a lot of us, we're already familiar with this, given that we already have the first lecture, if you had the opportunity to attend that. And also to explain some social innovation theories, given that this is just a very short period, we only have about an hour. So we're only going to focus on like three main theories to help us start thinking about how we conceptualize social innovations and how we measure those. And then we go in depth a little bit with the KAP-B framework and some of the applications of that. So in terms of the outline, like I mentioned, so it's going to be us talking a little bit about social innovations and then social innovation theories, the KAP-B framework, and we'll be built in a little bit of time for us to break out into sessions to use KAP-B framework to try to make sense of a particular problem. So to set the stage, so like I mentioned, some of us already are familiar with social innovation theories, or social innovations rather. So in one word, how would you describe social innovation? And you should be able to send in your responses using Mentimeter. The code is there. Is everyone able to see that? If not, you can also type in the chat. What's one word to describe social innovation for you? So we're gonna give it about a minute in the interest of time. And you can put in the chat as well. What is one word to describe social innovation? So when you hear social innovation, what comes to mind? Will be quiet. I know for some of us it might be morning, for some of us it might be evening. I know you're getting ready for dinner, but thank you. Yeah, impactful, thank you. Transformation, communities, absolutely. Locally generated innovation, inclusion, new ways to interact with people, communities, social justice, leveraging community wisdom, innovation, empowerment. Lovely, absolutely. Thank you all so much. Assertive communities. I love that. So we can see a lot of it is tied to community, is tied to impact, is tied to being helpful. So with social innovations, we're thinking about ways to leverage the wisdom of our communities to ensure that we are promoting social justice. We are coming up with transformative solutions, and also we are cooperating or collaborating with the communities. So as we go through the theories, so these theories are basically meant to help us to frame how we engage in our communities to ensure that it's engaging, is impactful, is participatory, is inclusive, is transformative. I see refreshing, I love that, and is novel. So absolutely, you all are amazing. So this is all what social innovation is. And the next few slides are also just going to provide us with some definitions, which kind of what you all already shared here captures that really. So with social innovations, and yeah, keep it coming. I'm going to come back to the word cloud later at the end of the presentation, but thank you all so much for that. So social innovation really, if we needed to include a definition, can be seen as an inclusive way, like someone included, inclusive way to solve problems or address issues that meet the needs of the end user. So we're ensuring that it's engaging, it addresses social issues that actually are meaningful to the community. So that's where leveraging the wisdom of the crowd is very important, as well as ensuring that we're engaging them to address whatever needs are meaningful to them and reflective of their resources as well as their needs. So social innovation also can be, I don't know what slide you all see. It's also a combination of, like, think about the different practices, social actions to better address needs and problems that exist within a community. So social innovation in health is very community-based, it's a very community-engaged process that tries to link social change with health improvement and allows us to draw on the diverse strengths, so the strengths of the communities, as well as the local wisdom and local resources and culture. So with social innovation and health, you're thinking about, like, what are the resources within the community that are important that we want to reflect while solving this problem? So social innovation typically argues that having local beneficiaries drive the development of the solution is very critical to allow for more sustainable and accountable services, so that beyond the lifespan of whatever you're trying to do, the community is able to support and drive the solution. So really at the core of social innovation and health, that is what is focused on, exactly what you all mentioned: impactful, social justice, engaging, and participatory. And so the key aspects of social innovation and health is it drives social impact, as you all already mentioned. At this point, we should skip through this because you already took care of the slides. So it addresses social impact, so linking social change and health improvement, and it also leverages community access. So we had seen community leveraging wisdom of the crowd. So it draws on the strengths of the local individuals and institutions. So with social innovation for health, we are not just thinking about the deficit part of the community, but also, like, what are some of the resources and the assets that they bring into the solution. and is embedded in strengthening community engagement. So we don't want a one-off engagement whereby we just come in to solve a problem without engaging the community. So with social innovation and health, it really calls for us to promote people-centered and holistic approaches for health in order to drive equitable health solutions. And also it fosters equity and social justice if done right. So if we center the community as well as community participation, it allows for us to foster equity in the way we do work. And really, if we're trying to promote health, it has to be done in an equitable way that allows for community engagement and ensuring that the voices of the communities and end users we're working with are reflective of that. So we're going to segue to social innovation theory. So think about these theories as basically a guiding frame for us as we're developing our innovation, such that it centers the community, such that is reflective of the voices of the community, and then it fosters social justice. So it calls for us to think about what are some of the strengths, and then what are some of the behaviors that are important within that community, such that we are creating solutions that addresses the problem while also strengthening the resources and the assets within that community. So there are several theories that help us to conceptualize or understand development of social innovations for health or even implementing them. Most of the key components of these theories are focused on the innovation. So one of the responses was novelty. So it helps thinks about developing novel and creative solutions for social problems. And sometimes novelty means that you're leveraging what already exists. It's just a new way of doing things that have been done or doing things differently. And also it values leveraging the strengths of the community. So framing solutions in such a way that it benefits the community. So it's very driven by the community need as well as the wisdom of the community. And also it focuses on promoting social justice. So pushing for that systemic change such that is addressing social and structural challenges. So a lot of the theories that exist focuses on that. But in the interest of time, we're specifically going to share a little bit about diffusion of innovations theory, which a lot of us are very familiar with when you're thinking about like innovators, early adopters. But for us to also think about like how can we design our social innovations in such a way that we are accounting for the different segments of the population, given that a lot of the work we want to do or the solutions we want to develop promotes health equity or promotes equity in general. So we want to ensure that we are developing our innovations to address the different segments of the population. And also we'll focus on the social capital theory, and then next we'll talk a little bit about the KAP-B theory. But this is not exhaustive, but we have a short period of time, so we're only going to focus on this three for this presentation. So this is more like a test, just a snippet of social innovation theories. So with the diffusion of innovations theory, so this was developed by Rogers. So some people might call it the Rogers theory. So it focuses on helping us understand how innovation spread through a community or a social structure. So with this theory, it factors in the adoption of whatever your innovation is or what your solution is. So what does that mean? It pays attention to who is using it and who is the first person to use an intervention or a solution that is already developed. And also it looks at the characteristics of the innovation. So depending on how an innovation or a solution is developed or is created, or the components, some people are more likely to use it than others. So think about a solution that is very tech-driven. So you can see it probably people who are more technical or technologically inclined are more likely to use that. And then we might be cutting out individuals who might not have access to technology. So those bits of our solution. So with the diffusion of innovation theory allows us to start thinking about like, what parts of our innovation, what are some of the characteristics of our innovation or our solution, and who is more likely to use that than who is less likely to use it? and also allows us to start thinking about how are we spreading information about our solutions. So how do we create awareness? So that's where community engagement is very critical and very centered in us creating our social innovation. We want to ensure that the communities are involved from the onset. So that way, with the communication channels or the ways we are spreading information or raising awareness or disseminating our solution is such that it appeals to the community, right? So we want to ensure that we're using dissemination or communication channels and strategies that make sense to our community. Excuse me. Then another factor that plays in when you're thinking about the diffusion of innovation theory is the time. So sometimes there might be there might be a critical time where you're a critical time where you want to spread information about your innovation. So there might be like an awareness day. So that might be your opportunity to get people to know about an innovation. And then sometimes it just might be leveraging other existing platforms that exist to raise awareness or to spread awareness about your solution. And also thinking about the social system. So who talks to who, right? So how does information spread through the community and who gets to know about it? So who are your gatekeepers? So with the diffusion of innovation theory, so it calls us to think about like really at the core of it, the community, who are your gatekeepers? What strategies make sense to them, as well as the components of your innovations. So when you look at this diffusion of innovation curve, which is down at the bottom of the slide, it starts from like your far right or left, depending on what section you're looking at. You have the innovators. So typically the people who are developing these solutions, which might be a lot of people on this call. And then you have the early adopters, who are the people who are most likely to use this innovation very quickly once it's out there. And then you have people all the way to the late majority. So how do you ensure that you are developing your intervention or you're spreading information about it, or having a communication channel that meets the different segments of the population? And for different innovations or different solutions, this curve is going to vary because the different components. So we've talked about a solution that has a tech component, and then maybe we might have a solution that, I don't know, maybe requires us to go into the community. So maybe you're more likely to meet people who congregate in a certain place. So at the core of it, so what we want you to get out of this is that when you're developing your innovation, you need to pay attention to what communication channels are you using and who are you trying to reach, and also making sure that you're developing components of your solution such that it meets the different segments of the population who might use your innovation. And then along the line, if we have any question, please feel free to put it in. I'm going to be checking the chats periodically. Okay, and then the other theory we want to introduce you to before the KAP-B framework is the social capital theory. So we've talked a lot about how social innovation in health really lies in community engagement. It also focuses on inclusion. And so the social capital theory focuses on social capital, so community engagement as a, sorry, I was looking at the chat. Community engagement as a key enabler or facilitator of innovation. So basically, with this theory, it suggests that our community network or relationships allows us to come up with collective solutions. So it really taps into that leveraging the wisdom of the crowd, that if you engage with your social network as well as your community as a social resource, you're more likely to come up with solutions that are appealing and come up with innovative solutions, so new knowledge and resources, and also to come up and also allows us to come up with solutions that fosters respect, trust, and shared values. So I think with this social capital theory, it really calls for us to pay attention to community engagement and ensuring that whatever solutions that we are creating or the way we are disseminating our solution, the channels are such that it fosters integrity, fosters trust, because if we want the uptake of our solution to be high, there has to be a level of trust with the community. And then that comes from first building the relationship. So at the core of it is really building relationships. So if you think about the two theories that we've talked about, the diffusion of innovation theory, I know we probably had looked at it differently, but if you try to look at it from a social innovation of health lens, it calls for the importance of like community engagement to ensure that we're developing solutions that match the different segments of our population. And then the social capital theory really calls for us to build relationship with our communities to ensure that we're developing solutions that are reflective of their needs and build trust, and also to come up with more novel solutions. Really, a lot of the innovations come from engaging the community. So we're gonna segue a little bit now. So if Mentimeter is gonna come up, if it doesn't, so the question here is, are there other theories that you all have used as you think through your social innovation development? If you could put those in the chat, given that Mentimeter is now cooperating a little bit, or actually if you go, it might actually work. What other theories have we used in our work? Are there other social innovation for health theories we've used? Diffusion of innovation. Okay, lovely. Thank you. Any other theories that we've used in conceptualizing our solutions? Social capital theory. Okay, I guess these two are like the very popular OGs. Okay, yeah, thank you. So quality improvement field is rather popular, especially when we talk about our champions. Absolutely, yeah. When you think about like your early adopters, your champions for innovations, absolutely. Thank you so much for that. So we're gonna move along to talk a little bit critique of traditional innovation. Oh, is that a theory? I'm not familiar with that. I'll make note of that for next time. Thank you so much for sharing that. Okay, thank you. So we're going to move along, and Godfrey is going to take us through the KAP-B framework.
Okay, thank you so much, everyone. We are on KAP-B framework, and please try to go to the next slide. We're on KAP-B framework, basically derived from the learning theory and the diffusion of innovation theory. KAP-B framework is a tool used in social and behavioral change communication programs to understand and address knowledge, attitude, and behavior. It owes its importance to the fact that across the globe, most especially in low and middle income countries, social unrest due to conflicts, differences in culture, religious practices, social economic status, and other social determinants of health continues to pose significant barriers to the access of even basic health services. Therefore, employing such a down-to-up approach like KAP-B, through which the uniquenesses in the situations in which people live becomes necessary when designing innovative solutions to meet people at their different points of needs. It consists of different components, with K representing knowledge, R is for attitude, P stands for practice, and B is the behavior. Let's move to the next slide. And so in the subsequent slides, we are going to look at how these different components can be explained and contextualized in applying to solve a problem. Starting with knowledge, this basically forms the foundation of this framework. The two major foundational bases of knowledge are: it helps in in-depth understanding of the problem in very setting in which it occurs. Here you might want to understand a problem and try to link it to its etiology, whether a particular problem in a community can be explained against the cultural or religious backgrounds. You want to know the local knowledge about the problem, what the communities know about the problem, what do they think about the problem. You want to know how people are dealing with it, the way in which they try to solve this problem. You want to understand the social structure of the community. And when I talk about understanding the social setup of a community, you're basically going to look at the different actors, the different sectors. You're going to look at the institutions that exist in this community. This is going to be helpful because It helps you gauge the potential of a community in solving its own problems. Another way or situation in which this knowledge can be contextualized as the framework or the basic foundation is because it helps in generating a feasible solution, that is the innovation that suits the community. By knowledge sharing, you can be able to offer a different background against which the same problem can be understood, and thereby creating an automatic need to adopt a different approach to solve the problem. For example, communities can have their perception of what the problem is, and they may understand it in a cultural perspective, like a disease condition in some communities can be attributed to spiritual or cultural beliefs. But then, if this condition has other backgrounds like scientific backgrounds against which it can be explained, scientific facts surrounding this condition, then you have an opportunity here to share with the community members a different backgrounds through which they can be able to see this problem differently. If you succeed in making the community see the same problem in a different perspective, then you have already created an automatic need for different approaches to be adapted to solve this problem. If the communities realizes that this problem can be solved using a different approach than the existing one, then through community engagement, you can be able to together innovate a solution that can be designed to suit that particular community and making its adoption very easy. Because like my previous presenter has said, there are factors that influence the adoption of an innovation. When the characteristic does not suit the situation, the community, it becomes difficult to adapt this particular innovation. But when you engage the community and try to figure out, design a solution that can be able to meet their situation, that can easily be adapted by the settings in which they are, then trying to spread, trying to diffuse this innovative idea becomes much more simpler and easier. In generating feasible solutions, you can also have an opportunity to identify new roles and responsibilities of different players in solving the problem using the new approach. When you have done community assessment and you are aware of the social structure that exists in a community, you are aware of the institutions that exist in the community, like the cultural institutions, religious institutions, you are aware of the public and private sectors that exist in a community, you know how you can engage these different sectors together to achieve a common goal, and that is trying to solve a problem using a new designed solution. Regardless of which approach you are contextualizing this, whether you are using, you are looking at how to assess the community to get more knowledge about the community or to try to understand the problem better, you need to obtain your information from credible sources. If you want to get credible information from a community, it is not advisable for you to rely on what you hear about this community from other people, but rather to be part of the community, to identify yourselves with the community so that you get the information you want from the credible source. If you are trying to give people a new background against which this problem can be understood in order to create a need to adapt a new innovation, then you need to as well tailor your message basing on credible sources, and that can be scientific facts surrounding a particular problem, the statistical facts, and also local knowledge that exists amongst the population, to try to blend it so that you are able to create a sense of familiarity of your innovative solution in the community to make its adoption become as easy as possible. Let's go to the next slide. Yeah, so basically the goal of this particular stage as the foundational stage is to try to get detailed information from the community, to try to make comprehensive assessment of the problem in question, but also to work together with the community to develop an innovative solution that suits the situation in which this very problem exists. So the question we have here is that what essential skills do you think are necessary for effective engagement of communities at this stage? What do you think you must possess as skills or set of skills in you in order to succeed in assessing the community comprehensively, as well as to work with this community in generating a feasible solution as far as the problem is concerned? You can type your answers directly, or even in the chat box. I'm already seeing answers that are coming up here. Thank you so much. Communication skills is very key because you need to communicate and be able to convey your messages. You need the empathy for sure, because you need to identify yourselves with the community. We have humility, indeed, effective communications, and so forth. Great communication skills, deep listening, very good. And I love the participation of the members. Keep these messages coming on, keep your answers coming on. Humility, efficient communication, empathy, listening, establishing rapport and trust. Of course, this is key because you are moving to a community that you might not have gone before, and you're interacting with people who might not have known you. So you need to create a better rapport with them, for them to open up to you. You have engagement, being part of the community, to listen, and inclusive. Yes, these are brilliant answers. You keep them coming. For the interest of time, we may keep going forward, but I'll keep continuously coming back to check on your replies. Thank you so much. Let's go to the next slide. Yes, we are going to the next concept of this framework, that is attitude. By attitude, we are contextualizing this to the way how people feel or think about the problem or the innovative intervention. The way how people think about the problem determines the way in which they approach it and the way how they will solve it. For example, I've ever been in a community where problems associated with the labor, for example, obstructed labor in this community was looked at as a punishment to the mother because of the sins that she might have committed in the past that she has not opened up about, that she has not confessed. And the perception of this community was that as long as the woman failed to confess, the mother would fail to deliver. But as long as the woman confesses the sins or any other bad deeds in the past, that was the point when she would smoothly deliver. So this has affected the perception of the community members, because every time a mother enters into a state of obstructed labor, people looked at her like someone who was sinful, and even to support this mother in that desperate point of need was a problem, because even if she continued in that situation and died, the perception was that she died because of her own sins. So the way how people look at the problem determines how they will react or they will address the problem. And also, in the context of how people look at the innovation, you are here concerned about the cultural and moral appropriateness of the innovation. when you're dealing with culturally sensitive areas, sensitive topics that present themselves as an exact polar opposite in all aspects of people's culture and religion. For example, I have experience of dealing with communities in implementing modern contraceptives. The idea alone presents itself as a total polar opposite in people's aspects of cultural and religious beliefs and practices. Unless you work with the community to engage them, to create better understanding, to give people a different view in which they look at this problem, it is difficult for them to see the need for a different approach other than what they already know. So you want to ensure that by working with the community through community engagement, this innovative solution that you are building can be acceptable in the context of people's culture and moral beliefs. And also, you are looking at the perceived effectiveness in solving the problem. When you are coming up with an intervention and you want people to have positive attitude towards it, you have to communicate and ensure that people grasp the potential effectiveness of this intervention as compared to the existing interventions that they have on ground. It is most engaging and transformative stage because this is the stage where, having done community assessment, the assessment of the social structure of this community previously, having known the different sectors, the different institutions that exist, you are now putting every players together to perform different roles in order to ensure that this new innovative solution is adapted to solve this particular problem. So it is engaging because the scale of your engagement broadens. You're not only now looking at a small group of people, but a wide range of people. So it is mostly engaging. And above all, it is transitional stage from being passive to being practical and self-motivated. Indeed, when you're dealing with the attitude change, you are transitioning from trying to make the community members have a rationale for change, but also wanting them to take active part in embracing this transformative innovation. You have different roles and responsibilities that different players performs. You want to transition them to start performing their different roles and responsibilities in order to maximize the importance of this new innovation. So as you design, as you ensure that the attitudes of people change, the way you approach, the way you design should be in such a way that there is a transition from being passive learners to active participants amongst the community members. And we go to the next slide. Yes, the next slide, we have a simple interactive question once again here. Since we have talked about the different, this stage being so engaging because you are trying to bring different players together to perform different roles in order to achieve a particular goal. We are asking you again, what examples of players do you think can be engaged in communities to affect the change at this stage? Different communities have different social structures, and different institutions, different players that you can engage. Basing on your experience, maybe in the communities that you live in, what examples of players do you think you can think of as far as effective change at this stage is concerned? Yes, we are talking about someone has already Someone has already given me an answer that is community gatekeepers. Yes, you need to penetrate this community through people who are known in the community. We're talking about different stakeholders. Yes, stakeholder management. We have community champions, yes, caretakers, community leaders. Yes, we have different kind of community leaders. We can even have cultural leaders, political leaders, all in this community. You can engage them to effect change in people's attitude. You have policymakers, yes. Policymakers can make youth leader depending on the social setting of that community. If you have youth leaders, yes, you can engage them. They can be significant part. The followers, stakeholders at different levels, of course, decision makers. These are brilliant answers. Keep the answers coming, really very good. And in many of the settings where I am, religious leaders work so perfectly well, because if communities have diagnosed a certain problem as to be spiritual, then you have another and the background understanding of this problem that is scientific or biomedical basis of this problem. Then you need to involve the religious leaders to change that perception. Community mindset changes, informal leaders, yet, yes, opinion leaders, very, very good. Thank you so much for your active participation. Let's keep the answers coming. I will keep on revising, going back and trying to read them. And so we are heading to the last, the second last component, that is practice. When you are addressing a particular practice in this framework, you are having two questions on your mind. One is, what are the current practices people have regarding the problem? What do they do to solve the problem? Or what cultural or religious practices you think is associated with this problem? Then you are also interested in knowing what people do different from the intervention. What people do different after the intervention. Like after rolling out the intervention, after the mindset change, after changing people's attitude, you now want to see what are they doing different as compared to the previous ways in which they are handling this problem. You want to see the extent in which they have adopted this new innovation and are incorporating this new innovation in their daily routines. Because at the point of mindset change, you have now succeeded in giving people a rationale for these particular behaviors. They know why they should behave, they should practice something in the new ways. So this is enough motivation for them. You now want to see how they are popping up with this new innovation, how they are actually trying to practice it differently in a way that ensures that this problem in question is solved. It is mostly learner-centered or centered on the community members or beneficiaries, because the practice is seen in them. Whereas in that state of knowledge or attitude, you are engaging different stakeholders, you're looking at professionals to try to drive and explain the same problem in different contexts. But here is when everything centers so much on the community members, and the technical personnel do what they do is more of an oversight role to see how they are popping up and how they are embracing this innovation. And this is the point when you should be flexible enough to also see what really works for the community and what is not working as you had predicted before. Because some of the things you might think may work may not be practical, and people may figure out how to do it in a way that suits them. And so as you take note of this, as you try to build the innovation, you are trying to learn what really works for people, what must be done about those things that do not work for people. You're trying to bring out the best practices that can be adopted and the ones that need efforts in order to improve the way how people adopt it. Let's move to the next slide. And also a simple question on this is what ideal level of learning should be demonstrated stage. We have different options here. The level of learning you think should be adopted by the community or learners at this stage in order to practice and to be able to blend in what works for them and what might not work for them in order to find the best practices in their setting in order to embrace this new innovation. And we have several options here. The A is remember, B is apply, and C being understand. Do you want the communities to understand, to be able to apply, or to be able to remember? At what stage would you think the communities or learners should get to? I'm getting several answers here. Let me open my chat box. Yes, I'm saying understand, apply. They should be able to apply. Yes. Understanding. Someone is talking about applying. Yes, applying, application. Yeah. It's also become a routine that is more like applying. Apply will enable them understand and remember. Yes. That is from MP, apply. Yeah, several people are going for the option of applying, which I think is indeed the level they should get to. You want them to be able to apply this new knowledge, not just to remember what you've told them, not understand what you've told them, but at this stage, they should be able to apply what they have learned in their situations, such that through their practice, you can be able to pick out the practices that works for them. And as far as adopting this new innovation is concerned, and you can think of how to modify what does not work in order to suit the situation of these communities. Thank you so much for your response. We move to the next slide. And finally, we're talking about behavior. Behavior here is like the desired behavioral outcome, which serves as a measurable hallmark of a real success. If you want to see that you have succeeded in applying the KAP-B framework successfully, you want people to get to that level of routine behavioral practices that puts them at the edge of living healthier lives and also preventing future occurrences of such problems, but not just the problem in question, but you want people to be proactive, to develop sets of behaviors, whether culturally or religiously or socially, that have health benefits. It can also be considered as the measurable level of competence developed by an individual or community. The level of competence in someone's learning can easily be observed in the way how the person behaves. If the person behaves in healthy ways, if someone has adopted the predicted healthy behavior, which you think should be the ideal in order to prevent some of these problems that you're dealing with, then it can be measured by, it is an indication of the competence of knowledge that this person has accumulated. You can also contextualize it as the desired aspects of health achieved by an individual or community, which serves as an evidence of transformation. You know that transformation has occurred when the community has changed, the behavior has changed. The behaviors that used to put them at certain health risks have been gotten rid of, and they have adopted new set of behavior that they continue with as part of their routine, irrespective of whether your supervision is, irrespective of whether you are around to supervise, or even you are, even if you are absent, there has to be a way in which they behave in a particular way. You want them to do more on their own, but also to do new things, to adapt new behaviors to prevent even other health issues, health problems, different from the ones you have handled or generated the innovative approach for. And you want them to do different, to exhibit a certain level of creativity that you can see and appreciate, that even when you have not taught someone this, the level at which the person has gotten into has exhibited a highest level of understanding and adoption of this healthy intervention. Someone has some concern here in the chat box. Many times there are conflicts between traditional behavior and modern civilized behavior. Indeed, it conflicts because the way in which people understand things in a traditional context is different from the way they understand it in a modern way. And the background of understanding sometimes determines people's behavior and how they will try to look at this whole problem. Let's go to the next slide. Yes, we're still looking at behavior as a hallmark of change. As we say, behavior is an expression of how much someone has learned. You might be wondering, at what level of behavioral adoption should someone get in order for you to be convinced that surely learning has occurred? You might want to see the community members becoming practical in a sense that they have ability to demonstrate concepts, ideas, or information into reality that can easily be grasped and practiced. Even if your presence may not be there, you want the community members to be empowered, to be able to even pass this knowledge to other people and to keep the message going generation to generation. And therefore, it is only when they become practical that they are able to pass this into the next generation, or they are able to transfer this knowledge. Then you want people to become innovative in a sense that they can use resources within their locality as a substitute to rather complex, innovative, materials that exist in a particular innovative approach. Sometimes you might want to adopt an innovation from somewhere to try to solve a problem in a different setting. But then people might not be having the knowledge or the materials that are needed that are found in the other setting from which this innovative intervention has been used previously. But when people get to be innovative, they can use their local materials as a substitute to these complex ideas, and it becomes beneficial. Then finally, you want people to become creative. Creativity, you're dealing with community that is multicultural. And then if you want to gauge the success of an innovative idea, then it should be determined by the extent in which it is able to be adapted by different people from different cultural backgrounds and different behaviors. Because you cannot be addressing people from different culture independently. But then you want innovation to get to this level where they are adaptable. I think this is where I am stopping. I give you back to Uchelma.
Thank you so much, Godfrey, for the very thorough introduction to the KAP-B framework. And I think we are just at the top of the hour. So I'll just try to summarize some of the things that you've talked about in terms of the application. We did have a breakout session, but you have access to the slides, so you can try to use that. But thinking about the KAP-B framework and some of the ways we could use that. So with the knowledge, attitude, practice, and behavior, that could start as the first phase of our entry into the community. So to help us identify and to assess what are some of the needs, what are some of the knowledge, attitude, and practices, and some of the things that came up in terms of that tension between what we might consider modern knowledge versus traditional knowledge. Our indigenous knowledge or cultural knowledge and norms are just as important as any other, right? So it's realizing the strengths within that. So that's where our assessment comes in and trying to understand the cultural context, and that's where the humility comes in to understand what are some of the uniqueness and the positive within this culture that can be tapped into. It's not always all negative, right? So let's say women typically will go to traditional birth attendants. So that shows trust with the traditional birth attendant, right? So what can we glean from that and try to leverage in developing our solutions? So our assessment of that and understanding of some of the existing knowledge, attitudes, practices, and existing behaviors can allow us to develop a more robust solution. Then we can try to develop solutions to address some of the needs that were identified while leveraging some of the resources. So our solutions and innovations should really be centered on highlighting and leveraging the community strengths while upholding the values that they hold true to themselves. And then hopefully you can develop some sort of prototype which you can test and then evaluate based on the KAP-B framework again to know what knowledge has changed. Has there been any change in practices and the behavior? And there are various metrics that will allow us to do that. So I hope we can see the ways we can apply this and how these frameworks can be applicable in the work we do. So first off, we are very grateful for you all joining, and thank you so much for the engagement. I hope this was very helpful and we can have some applications in the work we do. And at this point, we're going to pass it over to Yusha to help us wrap up and then to talk about the next step for other sessions. Thank you all so much.
Yeah, thank you, Dr. Godfrey. Thank you, Dr. Uchuma, for delivering such an interesting session. So yeah, really thank you for your today's presentation. So next week we will have our Say Hi Fellows, Dr. Jenna and Joel from Say Hi Philippines to deliver a session about human-centered design, and then they will share with you some of their experience about how to apply the human-centered design to the social innovation. So yeah, so at last I want to say thank you very much for all of you attending our session today. And I look forward to seeing you next week, the same time. And yeah, if you have any questions, just feel free to contact me directly. And we will also upload our archive video and the PPT slides to our official website in the next few 24 hours. So yeah, thank you all. Have a good day and see you next week. Bye bye. Bye bye. Thank you.
Bye-bye, one and all.
Thank you.
Have a good day. Bye.
Bye.
Bye-bye.
Bye-bye.
Thank you. Bye.
Bye-bye.
Bye bye.
Thank you.
Mm.